Welcome to the Falcon Pathology Review Series for USMLE Step 1. This is the second part of our lecture on environmental pathology, and we're going to focus here on nutritional deficiencies. Marasmus is a term used to define a deficiency of all nutrients. It can coexist with particular vitamin deficiencies and typically occurs in children less than 1 year of age. It is a term used when the child's weight falls between 60% of the normal weight for the patient's sex and age. Kwashiorkor is a situation where protein deprivation is relatively greater than the overall reduction in calories. Clinical features include hypoalbuminemia, which can lead to a generalized or dependent edema, what's termed a flaky paint appearance of the skin. There are alternating zones when you look at the skin of hyperpigmentation, areas of desquamation, and hypopigmentation, both in the hair and the skin. Hair shows loss of color, there's development of fatty liver, and these children and or adults affected by kwashiorkor develop immune deficiencies. Anorexia is a term that we use to refer to any sort of self-induced starvation which results in a marked weight loss. This is often a disorder that affects young women, and so you will see them developing amenorrhea from decreased suppression of gonadotropin-releasing hormone. These patients also develop bradycardia and cold intolerance. They'll develop constipation and a dry, scaly skin. It is often yellow due to excess keratin in the blood. Their hair takes on a fine, somewhat straw-like appearance, which is referred to as lanugo, and they develop decreased bone density. Bulimia is used to describe a situation where a patient, again often a young female, binges on food and then induces vomiting. Similar to patients with anorexia, these patients will develop menstrual irregularities, but due to the vomiting, they will also develop electrolyte imbalances, often a hypokalemia, which can predispose them to often deadly cardiac arrhythmias. They can aspirate from the constant vomiting, develop damage to their dentition from the constant exposure to the acids of the gastrointestinal tract, and if the vomiting is severe enough, develop esophageal rupture. Fat-soluble vitamins are ones that people can lack if they have any problem with the breakdown and the absorption of fat molecules. You see the lack of fat-soluble vitamins in conditions such as malnutrition, malabsorption syndromes, anything that affects the pancreas and leads to an exocrine insufficiency, and biliary obstruction. If you have an excess of vitamins, whether they be fat-soluble or otherwise, you call these hypervitaminoses. Now, the fat-soluble vitamins include vitamin A, which is found in animal products such as liver and eggs, and leafy green vegetables. It is a component of the visual pigment, so lack of vitamin A leads to night blindness and xerophthalmia. Vitamin A is also important in the maintenance of various specialized epithelias. Thus, a lack of vitamin A can lead to squamous metaplasia of the trachea, bronchi, renal pelvis, and tear ducts, the condition known as xerophthalmia, and the conjunctiva. A metaplasia of the conjunctiva is referred to as keratomalacia. Vitamin A is also needed for resistance to infection, so one who has defects in immunity with a lack of vitamin A. Hypervitaminosis A, however, can lead to physical changes as well, including alopecia, liver damage, and bony changes. The next fat-soluble vitamin is vitamin D. It facilitates the intestinal absorption of calcium and phosphorus, and obviously is important in the mineralization of bone. It is synthesized in the skin by UV light from precursor molecules, can also be found in milk and eggs. A lack of vitamin D results in deficient calcification of the osteoid matrix. This leads to a condition known as rickets in children and osteomalacia in adults. A lack of vitamin D can be due to a variety of causes, including secondary causes such as lack of sunlight, liver disease, where one cannot convert the precursor vitamin D to their active forms, or lead to a condition known as vitamin D rickets, where there's a lack of the renal alpha-1 hydroxylase. An excess of vitamin D leads to growth retardation in children, hypercalciuria, nephrocalcinosis, and renal calculi in adults. Continuing with the fat-soluble vitamins, the other two are vitamin E and vitamin K. Vitamin E, as you may remember from what is advertised in the news these days, is one of the major antioxidants, scavenging free radicals and keeping them from injuring cell membranes. Lack of vitamin E leads to spinocerebellar degeneration within the central nervous system. Vitamin K is a cofactor in the hepatic carboxylation of numerous procoagulants, including factors 2, 7, 9, and 10, as well as the antithrombotic factors proteins C and S. Lack of vitamin K is usually due to malnutrition and problems with absorptions and changes in intestinal flora due to antibiotic therapy. One who lacks vitamin K will often develop a bleeding diathesis, including hemorrhagic diseases in newborns. The picture on this slide simply demonstrates the bowing of the legs in a toddler who's been affected by rickets. This question demonstrates the way in which the USMLE Step 1 may ask you questions about vitamin insufficiencies. They'll give you some history about the person. Here, a 53-year-old homeless man who abuses alcohol. His physical exam is noted for cachexia, that is, he's very skinny, and he says he doesn't get to eat much, and findings consistent with dehydration. You start him on IV fluids, but then he begins to develop confusion and has trouble walking. Physical exam is notable for defects in the lateral rectus muscle function. This is one of the common findings in alcoholics who have their malnutrition and dehydration too quickly corrected and end up with a deficiency in thiamine. This patient is essentially demonstrating the signs and symptoms of Wernicke-Korsakoff syndrome, which we mentioned earlier in our slides on the abuse of alcohol. We now come to the water-soluble vitamins and what results from a deficiency of these. Vitamin B1 is also known as thiamine and is a coenzyme in various carboxylation reactions. A lack of thiamine leads to either dry or wet beriberi. Dry beriberi characterized by peripheral neuropathy with atrophy of muscles in the extremities. Wet beriberi being characterized by high output cardiac failure with resultant dilated cardiomyopathy. Wernicke-Korsakoff syndrome we mentioned in the previous slide and in our slides on the abuse of alcohol. The Wernicke has a triad of confusion, ataxia, and ophthalmoplegia. The Korsakoff part of the syndrome is when the patient expresses memory loss and confabulation. Vitamin B2 is also known as riboflavin. It again is a cofactor for many enzymes. Deficiency is rare because, at least in the West, we have begun to add this vitamin to various cereals and bread. However, you can see lack of riboflavin in patients who abuse alcohol, people who are on extensive diets, and people who are undergoing chronic disease states. The lack of vitamin B12 or riboflavin leads to cheilosis, stomatitis, glossitis, dermatitis, and corneal vascularization. Niacin is incorporated into nicotine-nicotinamide dinucleotide, NAD, and NAD phosphate. It can be made from tryptophan, thus both niacin and tryptophan must be lacking for one to be undergoing a niacin deficiency. However, deficiency of niacin does present with a classic clinical triad in pellagra. Pellagra presents with the 3 Ds, dementia, dermatitis, and diarrhea. Dermatitis is expressed as these patients having bilaterally symmetric areas of dermatitis on exposed areas of their body, diarrhea caused by atrophy of columnar epithelium, the gastrointestinal tract mucosa, and dementia from degeneration of neurons in different areas of the brain. Vitamin B6 is also known as pyridoxine. Its derivatives are also serving as coenzymes for many intermediate reactions. Again, the deficiency of vitamin B6 is generally uncommon, but you can see it in some subgroups, including those patients who abuse alcohol, patients who are on different therapeutic drugs, including isoniazid, patients who suffer from homocystinuria, and patients who have a pyridoxine responsive anemia. The lack of vitamin B6 results in very similar findings to what you would see with a riboflavin deficiency. That is, these patients have cheilosis, glossitis, dermatitis, and a peripheral neuropathy. This next slide simply demonstrates some of these findings. Here's the cheilosis seen in the lower lip of this gentleman, the stomatitis with the changes to the patient's dentition, glossitis with the thickening of the tongue. This is one of the slides showing the sort of dermatitis that one may see in pellagra. Note the sharply demarcated characteristic scaling lesions that one sees as part of the dermatitis with pellagra. Vitamin B12 is important for folate metabolism and DNA synthesis. A lack of vitamin B12 will produce a megaloblastic anemia. It is also needed for maintenance of spinal cord tracts, and a lack of vitamin B12 leads to specific degeneration of the posterior lateral spinal cord tracts. Defects in vitamin B12 are almost always caused by malabsorption, most commonly seen with pernicious anemia. Folate or folic acid is essential for transfer and use of 1-carbon units in DNA synthesis. A lack of folate, again, given the fact that it's generally supplemented within Western diets, is due to the abuse of alcohol or potentially people who are on chemotherapy. It also presents with a megaloblastic anemia, but without the neurologic symptoms, as levels of vitamin B12 are generally intact. You'll also remember that folic acid is important in moms and moms-to-be as perhaps our best weapon in preventing neural tube defects or spina bifida. This is just an example of an individual who has a vitamin C defect and suffers from the classic sort of dermatitis that one sees in scurvy. This is an example in this slide of the classic hypersegmented neutrophil that one associates with vitamin B12 deficiency. One can also suffer from mineral deficiencies, whether that be iron, zinc, or iodine. Iron, you of course know, is an essential component of hemoglobin and iron-containing metalloenzymes. Thus, if you're missing iron, you cannot make appropriate amounts of hemoglobin, and your anemia will be hyperchromic and microcytic. Zinc is a component of numerous oxidases in the body, and a lack of zinc can lead to dermatitis, growth and retardation, and infertility. Iodine is obviously one of the components of thyroid hormones. A lack of iodine leads to the development of goiter and hyperthyroidism. An example of a goiter is seen here in this patient. Note the prominence over the Adam's apple in this man's neck, most likely due to an iodine deficiency. And this is a child with the sort of dermatologic and findings within the lips, the sort of chelosis that one expects to see in a patient who has a zinc deficiency. And that ends this Falcon lecture in the Pathology Review Series for USMLE Step 1 on environmental disorders.